This week we have a special episode with a special guest, my wife, the lovely Marina. The topic is pregnancy, so I'll have her tell you just a little brief overview about her pregnancy, and then we'll get into back pain related to pregnancy.
Hey everybody, so I'm 28 weeks pregnant, and I have been experiencing a little bit of back pain during my pregnancy, specifically like SI joint pain. We're going to talk about what has been causing that pain.
We're going to talk about the hormones that are released during pregnancy, which are primarily responsible for why back pain is so common during pregnancy. The graph is showing several different hormones and their timeline over the period of the weeks of pregnancy. And we're going to be focusing in specifically on this hormone called relaxin, and that is represented by this blue line here. So Marina, can you tell them a little bit about relaxin?
So relaxin is a hormone that is released mostly during like the 8th and between the 8th and the 12th week of pregnancy, and it loosens your joints and softens the connections in your pelvis so that your pelvis is ready to hold the weight of a baby and then eventually give birth. For me, in between weeks 8 and 12 during my first trimester was when I was experiencing the most pain in my back and in my pelvis and my SI joint. And I really noticed that. And Dr. Ryan kind of warned me about it ahead of time. He was talking about how I would experience that and that I should prepare ahead of time. And I was doing my best, but I still definitely felt that pain during 8 and 12 weeks.
So what we know is if you are pregnant, especially early on in your pregnancy, you can know that this hormone relaxin is going to be released, and we can see the predictable timeline of what happens. And this does have an impact on your body and your joints, especially your pelvis. As Marina shared, it is preparing your pelvis to give birth, and it does soften and relax all the ligaments in your pelvis, and that's what leads to a very high frequency of sacroiliac joint pain, or SI joint pain. And so we can see that the relaxing does continue throughout the pregnancy. It's just the highest in week 8 through 12, but we can see that it does continue. And so can we share what you've done that has been helpful, and also just any general tips that you have?
I think the biggest thing I would have done differently was to be more proactive about experiencing SI joint pain with regards to strengthening my glute muscles. So that means like preparing with bridge pose and the butt buster, deadlifts and squats with some weight. So I would have prepared up to that point. And then also being aware of symmetry in my body, like not crossing my legs, trying not to spend too much time sitting, because after I was sitting, I could always feel after I stand up that my SI joint was loosened more. So just finding ways to strengthen and tighten that SI joint where my spine connects to my pelvis.
So we are going to demonstrate the butt buster bridge right here in a minute, and we're just in the beginning of the 3rd trimester, and sleeping is starting to become more of an issue. Let's talk a little bit about what's been going on with sleeping.
Well, sleeping on my back is not possible anymore because of the weight of the baby pushes down on specific arteries.
The abdominal aorta, so
Yes.
it blocks the blood flow to her and the baby.
Yeah, and so I can't sleep on my back. So I have to sleep on my side. My left side is the best side for pregnant women to sleep on for digestion, circulation to the baby. But then eventually my shoulder gets tired and my hip gets tired a little bit of sleeping, that many hours. So I have to actually wake up in order to change sides because I have to do it so consciously and then get comfortable. And then I have to sleep on this side for a little bit with a pillow in between my legs. So it's just that constant switching back and forth.
She actually has been mentioning that she feels shoulder pain after a while of sleeping on her shoulders. And that is true for anyone that sleeps on their side too much. It is kind of stressful on the rotator cuff and just the shoulder joint. It's not ideal to be on your shoulder all night long, every night. It actually can lead to some issues over time. And so this 3-quarter position that we're going to demonstrate actually seems to be a pretty good middle ground between side sleeping and back sleeping. especially for someone who's pregnant who can't sleep on their back, doesn't want to be on their side all the time. So the first thing we're going to do is demonstrate the butt buster bridge. All right, so she's in the bridge position. It's very important the way that you initiate the bridge and how much your core is involved, and Marina already knows that stuff. If you don't already know that and you're not in the program, then I can just direct you to the free trial, which goes through exactly how to do the bridge, the perfect bridge as we call it, in a very healthy way for your spine. So go ahead and come on up. Good. And so she has the band around her thighs, and as she's pushing out, what's happening in her pelvis is the opposite. It's getting compressed together. So it actually squeezes the sacroiliac joints, those two joints, it squeezes them together. The glutes are responsible for that, and it's been pretty effective for you. Okay, that's the butt buster bridge for anyone that doesn't know, and you can actually go ahead and do as many reps as you want. A lot of the program is about tuning into your body and feeling through the movements and low intensity. This particular exercise, you can actually go kind of hard and get that burn in your glutes. You can get up off the ground after doing it and just feel quite a change in just like how your body feels. It can feel better. We're going to get prepared to show the sleeping position, wedge pillow, or a bolster. This is what we've been using for her sometimes for the 3/4 position. So we'll go ahead and place it behind her. And so you don't need to have a wedge. You can actually use a regular pillow. And this is not only for pregnant women. This can be extremely helpful for men and non-pregnant women as well. Just to be able to take a break from sleeping on your shoulder, and for people who aren't that comfortable sleeping on their back. She's kind of rolled back onto the wedge a little bit, and you can use more pillows if you want. Just get it to the point where you are comfortable. That's the goal, and using as many pillows as you need to be able to do that. And she's also got a pillow between her knees, which we actually, sometimes I recommend even more than like a thin pillow, like maybe a thick pillow or even potentially 2 pillows between your knees. And if she had both pillows between her knees, that would kind of line her up, her hips up a little more. So you can get to the point where you have like a really thick couch pillow or something that will just help your hips stay in alignment with your back. That's a 3/4 position. She's not really on her shoulder, and she's not really on her back where the baby is pressing on that artery. All right, that is the demonstration for today. Before you go, Marina, would you mind just sharing any final tips, final thoughts that might help new pregnant women or maybe pregnant women further along?
Just listen to your body, do what feels good for you. And I highly recommend to be proactive about strengthening your glutes ahead of time and just staying really positive and staying active in your body. Yeah.
Cool.
Yeah.
Thank you so much.
Thank you.
You're a wonderful first guest and the most appropriate one to have. So thank you.
Yeah.
Feel free to share this with anyone who you know that might benefit from this. If you know someone who's pregnant or newly pregnant, a lot of the information that Marina shared, I believe, can be helpful if you can get ahead of the problem of the relaxin being released in your body that inevitably loosens the ligaments in your pelvis and can often cause SI joint pain. Don't forget to hit that like button and support the stream. Thanks again, everyone, for being here. Until next time, get down on the floor and connect to your core. Take care, everyone.